In today's microbiological and biomedical research laboratories, procedures are conducted that can generate infectious aerosols and biohazards. These aerosols must be contained to protect laboratory personnel as well as the environment from exposure. Other procedures require a sterile environment with non-turbulent airflow so that cells and other cultures will not be contaminated while they're being handled. Both of these procedures can be performed safely in a biohazard safety cabinet using proper working techniques. This training program will describe the proper procedures to follow when working a biosafety cabinet, including how to plan your work in the biosafety cabinet and what to wear, how to prepare the cabinet, as well as the materials and equipment for your work, how to minimize the release of aerosols, disruptions to the cabinet airflow, and the contamination of your work, how to clean up spills during work, how to remove materials from the work zone, and procedures to shut down the cabinet and to remove protective clothing. Prior to starting work, you must carefully plan the steps to be used in your procedure. List all the items required for your work, including equipment, cultures, media, and other materials. Your list will help you prepare necessary items before starting work. Depending on the work being conducted and your laboratory's standard operating procedure, you should wear appropriate personnel protective equipment. Before donning your protective clothing, wash your hands thoroughly with germicidal soap. When conducting low-risk work, wear a long-sleeve lab coat and rubber gloves. Ensure gloves cover the cuffs of the lab coat. For higher risk work, such as Biosafety Level 2+ and Biosafety Level 3 work, a solid front long sleeve gown and 2 pairs of gloves are more appropriate. Make sure the top gloves cover the gown's cuffs. There should be no exposed skin. Gloves and garments will protect you from the agents you work with and will also keep you from contaminating the cabinet work zone, your cultures, and other research materials with skin flora. If a germicidal UV lamp is being used, you must deactivate the lamp as soon as you enter the laboratory. Raise the front sliding sash to the opening height and turn on the fluorescent lights. Ensure that air intake and exhaust areas of the cabinet are free of obstructions. Start the cabinet blower and allow the cabinet to purge for 3 to 5 minutes. This will remove the airborne contaminants from the work zone and stabilize the cabinet airflow. Adjust the height of your lab chair so that your armpits are approximately level with the bottom of the front sliding sash. This will ensure that your face is protected by the front sash, while giving you plenty of room to work. Wipe down the interior work zone surfaces with an appropriate disinfectant, including the front air grill, with a suitable disinfectant such as 70% isopropyl alcohol. The most effective disinfectant will depend on the organisms manipulated and the work conducted in the biosafety cabinet. Wipe down the external surface of items with disinfectant and load the cabinet work zone with all the items you will need for your work. Check the list you have made earlier on. Make sure you have everything you need before you start. Nothing should be taken out of or put in the biosafety cabinet once you begin working. Pay special attention to the front air grill, which must not be covered as illustrated here. Disruption to the inflow of air into the cabinet will compromise the cabinet performance. The cabinet work zone should not be overloaded. The biosafety cabinet work zone should be divided between 3 areas: so that you have a clean area, a working area, and a contaminated area within the work zone. These areas must be located to minimize movement of clean items over contaminated items and vice versa. Place your waste container in the contaminated area. Place your working equipment and specimens in the working area, and your supplies should be located in the clean area. Transfer materials from the clean side through the work area to the contaminated side. Never use sharp instruments, particularly needles and syringes in the biosafety cabinet. Avoid moving your hands in and out of the biosafety cabinet. When working in a biosafety cabinet, use slow and deliberate movements. Avoid side-to-side arm movements as much as possible. Enter and exit the cabinet from straight on. Biosafety cabinets will control aerosols, but will not eliminate contact transfer. It is essential that proper aseptic techniques be followed. Keep the top over petri dishes or tissue culture plates. Transfer viable material as far back in the biosafety cabinet as possible, and always recap vials. Work with one specimen at a time and recap before going on to the next. Discard empty tubes immediately. This will minimize contamination of your work. If a spill should occur while working in the cabinet, cover the spill with a towel and soak with a 10% bleach solution. After allowing 10 to 15 minutes for contact time, wipe the surrounding exposed surfaces and equipment with an appropriate disinfectant. After cleaning up a spill, discard your gloves and replace them with a new pair. Allow the cabinet blower to run, purging the work zone for several minutes. And be sure to autoclave all contaminated materials. After completing your work, run the biosafety cabinet for 2 to 3 minutes without activity to purge the air. Disinfect the outside surfaces of all items to be removed from the biosafety cabinet. Place all waste in the discard container within the biosafety cabinet. Remove, discard, and then replace your gloves. Then remove all the items that have had their surfaces decontaminated. Remove any waste and disinfect and autoclave or place in the appropriate waste stream. Disinfect all biosafety cabinet surfaces, including the work zone side and back walls, and the front sliding sash. You should also periodically decontaminate under the front air grill. Once the biosafety cabinet is appropriately disinfected, turn off the lights, the blower, and shut the sliding sash. Degown properly by removing and disposing your gloves and removing your lab coat. Wash your hands and forearms with germicidal soap and water. If you perform higher risk activities in the cabinet in a biosafety level 2+ or 3 laboratory, remove your outer gloves and then your gown, being careful not to contaminate your skin or your street clothes. The outer gown and gloves should be disposed of as biomedical waste. Wash your hands thoroughly with germicidal soap and water.